David Armstrong, podiatrist, podiatric surgeon, professor of surgery and neurological surgery at the Keck School of Medicine of the University of Southern California. So we've worked for many, many years, maybe the last 30 plus, with different offloading tools and different removable cast boots. And there have been some that have done a really good job in reduction of pressure. There have been others that have design characteristics that were maybe favorable but didn't offload. Our experience with the Defender boot now is that for the first time you have both. You have a technology that happens to offload really well, so it carries that functional check piece for our patients. And then really importantly, it's something that is designed beautifully and elegantly, so our patients, they feel like they like the way it looks. It almost looks like they're wearing a pair of athletic shoes. We can do something to our patients, right? We can give them a device that offloads them well. We can even lock them in a device that offloads well, right? But in doing that, we are doing something to them. If you give them something that looks good and that they maybe want to wear, what you're doing is something completely different, and you're doing something with your patient, and that's really great. Right now, what we're finding, and I'm a principal investigator along with Bijan Najafi at UCLA in the NIH-sponsored Smart Boot study, and we're starting to find, speaking of doing something with them and not to them, folks that may not be wearing the device, they can get a little information on their smartwatch saying, hey, great job, you're wearing it, or hold on, that device it's acting like a doorstop and not being on your body. And doing that with them is a lot better, because then you can be talking to them about that. And then you overlay kind of an AI-based kind of Sherpa to where you're having a dialogue with these folks 24/7, and it changes the game. So it is really, really exciting. You know, we're 174 of 210 patients enrolled, but as we are identifying some of these folks, we're starting to see that doing this and doing something with these patients appears to be positive. And we're starting to see a real signal favoring healing in that patient population, which is not only surprising, it's pretty life-affirming. So it'll be that patient that maybe doesn't want to wear another device because it's too heavy, because it's too ugly, and maybe because they feel like someone's just locking something on my body and not doing it with me. That woman, that man, I think would be ideal for something like this, I think. Listen, you don't need me to tell you this, but bravo on all these efforts. This is easy to talk about on a video, and it's hard to do in real life, so good on you. And here's to that, here's to making a difference.